Another tool for used in quality improvement is known as root cause analysis. Um, this is used by asking the five questions, the five whys, um, and going to the source of the problem. In this case, first question is why are patients expiring from the septic wounds? Um, this time the wound wasn't treated efficiently. And why wasn't the wound treated efficiently? Some factors are there was a lapse in IV antibiotic treatment, and wound care could have been more comprehensive. This leads to the question, why was there a lapse in IV antibiotic treatment and wound care not comprehensive? Well, patients stopped the IV antibiotic administration multiple times. There was no advanced wound management agencies available to be called out, and wound cultures were not obtained timely. And this leads to the question, why did the patient stop the IV antibiotic administration? Wound management was not called out, and wound cultures not obtained timely. The patient didn't understand the severity of her infection. Well, either that or when she was in some form of denial. And advanced wound management was not an option 7 years ago. Um, wound cultures not being obtained timely would be an error on the behalf of the clinician. The final question, why didn't a patient not understand the severity of her infection and what wound treatment interventions could have been performed 7 years ago? Um, Patient education, it didn't have enough repetition, also involvement of teach back method, just basically getting the point across to the patient of how severe the wound was, and that even though it's their choice, what are the outcomes of not going to the skilled nursing facility or refusal of going to the ER at times. Also, what could have been done is that wound pictures could have been taken. We could have printed out the images and showed them to the physician. That might paint a better picture to the physician as to treatment of the wound. And also obtaining those wound cultures sooner, sooner than later.